Who are you?
I'm your husband and this is your daughter.
I don't have a husband.
We've been married for over 50 years.
Where am I?
You're at your new home in a facility.
I don't want to be at my new home.
It's just safer this way. I can't take care of you at home.
I want to go back home with my parents. I don't want to be here.
They've been gone for a few years.
No, I talked to them yesterday. I know I did. No, I know I did.
You didn't.
I know I did. No, I know I saw them. I know I saw them.
I think we should try and calm
No,
down
I
a
know I
little
saw
bit.
them.
Do you want to just give her some space and we should walk out? Okay.
I know.
Hi, I'm Amber. I'm going to be the provider today. Do you guys have any questions or concerns about Alice today?
I'm Paul, her husband.
And I'm her daughter.
Alice has had Lewy body dementia for about a year, but we've noticed that her hallucinations, specifically about children, have been getting worse, along with her tremors, and she hasn't been sleeping through the night like she used to.
And then when I talked to her on the phone, her depression, she seems to be really depressed and very negative about things around her. She's not very focused. She stares off into space a lot, and her memory is getting worse.
Okay. Alright, I think we should step out in the hall, give Alice some alone time, and I can go over why these symptoms have been progressing a little bit, okay?
Yeah, that sounds good.
Okay.
Laura and I are wondering what this disease all entails a little bit more in depth and how it's going to affect my wife and her mother.
And we've just been struggling a little bit, so we want to gain more understanding of what this disease is and how it affects her.
Yeah, so Lewy body, that's what she has, is Lewy body, and it was named in 1980. There are 3 types of Lewy body. So there is the brainstem, transitional, and diffuse. Lewy body is caused by this alpha-synucleal deposit protein that happens in the brainstem. Okay, so Lewy body disease what you guys have noticed in Alice will only continue to get worse. So her cognitive function will only worsen, as well as her movement. Her sleep she'll probably get less and less sleep, and her mood will only get worse. So the depression that you see in her, that's common. It is hard on family, and the best thing that you can do for her is to just try to comfort her, make sure that she knows that she's loved. You guys coming to visit her more and more only helps her. And Lewy body is the second most common type of dementia, whereas Alzheimer's comes first. Same thing, Alzheimer's is just a little bit different form of dementia.
So what's happening in her brain at a cellular level to make all of these changes occur in her behavior?
So Lewy body disease happens in the frontal lobe, which can cause impaired decision making and confusion, which is where you see the memory loss, and then her basal ganglia, which is the slow, stiff movements, also can cause tremors, and then the occipital lobe, which is where the hallucinations come from, which progress, which means that the cells in her brain are just deteriorating, meaning she's not making as much cells as she was. And then her brainstem, which is where her sleep comes in, so she's not getting that REM, which can cause mood disorders, which can throw off her whole day, which can also be caused by the depression that you're seeing. And then the temporal lobe, which is the memory, so that's where you're seeing she might not recognize you guys as much. She may think that you're somebody else, stuff like that. Anything else?
No, that makes sense.
Thank you.
Of course. So I forgot one more thing. So when we're taking her vitals, her blood pressure may drop, which may result from her being dizzy. She might feel lightheaded, and that can also lead to her falling. So that might be another thing that you guys might just want to watch out for, is when we're not taking her blood pressure, you could just help her stand up, help her walk a little bit, because she might feel lightheaded and that could cause her to fall. Sound good?
Yeah. Thank you.
Hi, I'm Jasmine. I'm the pharmacist for Alice today. I just want to go over some of the drugs that that are prescribed for her. So, the first drug that is prescribed is donepezil. It's a cholinesterase inhibitor, and she'll take 5 milligrams every day. It's important that she takes it every day and she doesn't stop it abruptly. She might experience some insomnia or dizziness or nausea and vomiting. In rare cases, she might have seizures. If you notice any signs of a seizure, it's important that you give me or the doctor a call. And then I'm also going to be prescribing her an antipsychotic. So these are very, they can be very dangerous. They can cause death in very rare cases. This one is risperidone. We'll start her at 5 milligrams every day, and then if she's able to manage that, in maybe 4 to 6 weeks, we'll give her 10 milligrams every day. So for this one, again, watch for seizures and watch for if she has any suicidal thoughts. It's really important that you give us a call. Same with the other meds. She might experience some GI upset problems, nausea, vomiting, insomnia, some restlessness, stuff like that, but it is important that you call me if there's any signs of suicidal thoughts.
Sure.
Do you have any more questions about the meds that Alice is taking?
I'm just wondering why exactly she's taking these meds.
Yeah, so the antipsychotic should help with her hallucinations, some of the delusions she's having and the paranoia. And then the donepezil should help with her mood, should kind of help her memory and lessen her confusion.
Okay, sounds good.
Do you have any other questions or concerns?
I think that's it.
Okay. Alice's nursing diagnosis is acute injury related to altered perception and impaired cognition, as evidenced by visual hallucinations and fluctuating awareness. Alice's prognosis is fair to poor. Dementia patients usually live 5 to 8 years after initial diagnosis due to complications like falls, cardiac complication, depression leading to suicide, and medication complications. Dementia patients are diagnosed through symptoms. Also, MRI showing brain atrophy, sleep studies, and ruling out Parkinson's and Alzheimer's.
Yay! Yeah. Oh, Paul, how I've missed you. I love the life we've built together.
I love you, Alice. I will never give up on our beautiful love we have. I'll see you tomorrow.
Who are you?